Brought to you by Sip for Your Cause.
Hello, and welcome to another episode of Let's Talk Nonprofits, where we enjoy discussing nonprofit best practices to help nonprofits improve, and again, focusing on increasing their awareness, the funding, sustainability, and ultimately their impact. We thank you for joining us, and again, we have great guests with us on our show today, and we look forward to talking with them. But before we get to that, we really want to thank our sponsors, our show sponsors, sipforyourcause.org, as well as our advertisers who make this opportunity possible. So we thank you. We ask that you go and visit them, especially during the commercial break, and utilize their services. Today we're talking health with Dr. Jada Moore-Ruffin and Dr. Karyl C. Patten of Whitefoord, Inc. Dr. Moore-Ruffin, would you please share with us what Whitefoord, Inc. is all about?
Sure. Whitefoord, Inc., which is formerly Whitefoord Community Program. The mission, let's start there. The mission is to partner with families and the community to ensure that all are healthy and that children have what they need to succeed in school. So that says a good bit about what Whitefoord is and what it has done over the past 20 years. Whitefoord started as an initiative to assist the neighborhood with remedying some of the concerns that were not only experiencing, the adults were experiencing, but also the children in school. It was around health, and the health was impacting the education. Yeah. So that's what Whitefoord got started as, and it's a health initiative that really started to see a greater need in the community. Social services were needed. Early childhood education was needed. After-school programs, and all of those things eventually evolved into what is now Whitefoord, Inc.
And that's the thing I think amazes me most, and I think Whitefoord, Inc. is an excellent example of how you morph. You know, we talk about that in the business sector often with business, helping them understand that you just can't stay this thing or you won't survive. But more so than morphing to survive, you guys changed to address the issues that you saw that were in the community. Dr. Patten, I would like to ask, what are the demographics of the communities you serve?
Well, we serve about a 20-30 mile radius, and we're primarily located out of East Atlanta. We see people from as young as 6 months, as old as 85 to 100. There's no one that we turn away.
Wow.
So we are pretty much, we even have patients come as far as Dalton and some as far as Savannah. So we've pretty much, our demographics has changed over the years, but we're pretty much located in East Atlanta, but I would like to say we're pretty much all over the state of Georgia.
Okay. I want to share with you guys, I know that you heard me identify the dentist and you heard me identify the medical doctor, but what I would like for them to get into, because I think it's significant, because you actually provide both areas of service to them. Dr. Patten, in terms of the dental services, what degree or range of services are offered?
I like to tell everybody that's a common question that we get often. We are full service. We provide everything. I can't say that we do some of the specialty services as much, but we have a remedy for that as well. We are heavily connected with the communities, with the dental community here in Atlanta, and if we need to refer things for them, we do that as well. But we're full service. That would be fillings, that would be dentures, partials, extractions, the whole gamut.
I'm glad you both are present today because you have clarified some misunderstandings that I've had. I've always thought that you serviced the children, because it was school-based and all, but you just said everybody. Now let's go to the medical side of things now.
Sure.
So talk about what range of services do you?
I'm really glad you brought that point up because that is a misunderstanding out there in the community, in the health community even. So Whitefoord does full service medical and dental, behavioral health, health education, all of that under one roof. Wow. We consider ourselves a comprehensive health center.
Love it.
So you are able to get services under one roof as much as you would in any primary care setting. We do primary care medical as well as dental, as Dr. Patten described. The good thing is that because we have a behavioral health team on staff,
Yeah.
if there are needs that are behavioral or mental health, or there are any challenges with adjusting to some of the things that life throws at you,
Yeah.
we have a partner that's right there under that roof to assist us in ensuring that you have everything that you need to be successful and to thrive, not just to survive.
Yeah.
So with that, and having the health educator that's there to reinforce the messages that may come up in the individual health visits, that's a real big benefit as well, because very often patients will leave with questions. We definitely try to answer as many of those as possible. But I think it's great for us to be able to offer yet another member of our team that can spend that additional time to talk through some of the challenges. Because for some people to have a diagnosis that is considered a chronic disease, that's something that you have to bite a little bit at a time to learn how to manage that well. We have a care coordinator that assists us with she's the glue, I say, to the things and the services that we provide. She ensures that things don't fall through the cracks. If there are needs that we may not be aware of that are keeping the patients from having everything that they need to care for themselves well, then they're there to assist as well. And the good news is that very recently, over the last couple of years, we've even been able to bring on outreach and enrollment specialists. So if you're familiar with the Affordable Care Act, or otherwise known as Obamacare, we have people that are right on site that are able to assist with taking applications, with getting information. If you have an application that's in progress and you're not really sure of where you are in it, they're able to explain these things to the consumers, and you do not have to be a patient in order to benefit from that service at Whitefoord. So those are just a few of the things that we do at Whitefoord.
Well, I tell you, you've heard it, and believe me, we have much more to discuss. But I'm going to be transparent, as I always am with our audience and our viewers, that you've blown me away. I don't know if it's just because I've known Whitefoord maybe in the beginning stages.
Sure.
I don't know.
Sure.
But you guys, you're a full-fledged practice to support the community at large.
Absolutely.
And I commend you. I don't know how the concept came about, to even expand and become comprehensive. But my hat's off to you, ladies. Great job. Well done. Let's go back over to the dental side. In fact, what I really want to ask, and it may not be more specific with dental, but you talked about the Affordable Health Care Act. And what about insurance? So do you accept people with insurance? Do they have to have insurance? Or
Great question. We do accept insurances, and we accept all types of insurances. But being in East Atlanta, sometimes people may not have insurance, and for those people we offer a sliding fee scale, and what that's typically known as it's income based. And so if we can't get you with the insurances, we can usually assist you with our sliding fee. So that enables most people to attend and come to our clinics. Dr. Jada said, oh, this is just a wonderful clinic. She said one thing, but she didn't mention all our different locations. If we can't serve you with the insurances, we have several locations that we're able to serve you as well.
Okay. Wow. Okay. While you were talking, my mind just went back to the old days of healthcare, and they probably call it healthcare, but medicine is generally what they talk about, dental, but when it was more community-based, and when, like you say, there was not always the ability to pay, but there was a way that community and family doctor or dentist worked with you to be able to get what you needed. And that's what I'm hearing. You guys are this new age family physician, dentist that is here to make sure by any way possible that people get the health care that they need.
We're proud of that. We're pretty proud of that.
Should be.
A lot of times some of the patients may come in and they often say, how can I afford your services? We offer payment plans as well as the insurances. So we meet them where they are, and that's what we typically do.
We've got to help you get the word out. And I know I'm on broadcast, but I'm committing to that. This is just too much value to communities and individuals for you to be such a hidden gem And you know, you've already impressed me, but then when you tell me that I can come and make payment arrangements, you know, it speaks to where your philosophy lies. You know, and again, I'm commending you for taking that step, that commitment, because that's huge. And not just in the medical realm alone, but being in business, period, and taking payment arrangements for services. So my hat's off to you, and BizLinks TV Network, we will be in dialogue with you further to find out how we can help you spread the word and get you these people that need your services. So I'm going to ask you at this time, guys, as you're looking, stop right now. I know I always encourage you to take notes on this show, but I'm going to ask you to listen at this point as I ask them to tell you how you can reach them, how you can get in touch with them before we go to the break. But would you mind just telling how they can reach you?
Sure. We can be reached by phone at 404-373-2282. Again, that number is 404-373-2282. Alternately, if you want to specifically call our school-based health site, where we do focus on pediatric medical care at that location, but we do have dental services, as we mentioned, at multiple locations. The number is 404-588-0101. Again, that number is 404-588-0101. You can also connect with us on the website, www.whitefoord.org. Let me help you spell that. It's www.whitefoord.org.
Well, we thank you. Guys, again, while you're watching, get your other, I know you have another device out there, internet access. Just pull them up on the website and see what they're about and see where they are in proximity to you and reach out to them, especially if you don't have access to health care, if you don't have a primary care physician, if you do not have a dentist, you know, at this time, and even if you don't have access to behavior services, please go to the website, read about it, look around, find out where they're located and which ones are closest to you. Reach out to them. You don't even have to tell them BizLinks TV Network sent you. It's more important that you just get there. But please take advantage of everything you've heard. We're going to take a commercial break, and we're going to be right back to discuss more of the services and opportunities for you to take advantage of, as the Whitefoord Inc. is just doing phenomenal work in the community. So again, we thank you, and we'll see you after this commercial break.
What happens when soldiers come home? Brene Foundation offers hero support to ensure that our heroes abroad can continue to be heroes at home. We link veterans with organizations who are dedicated to guiding the transition from military hero to civilian hero. If you want to find out how you can support our troops at home, please contact the Brene Foundation or visit brene.com.
Does your son need a more challenging, focused, and encouraging educational environment? Renaissance Christian Academy is an affordable private school for boys located in McDonough, Georgia, with certified teachers that are uniquely equipped to help your son master learning. You're welcome to schedule a tour of our facilities by calling 770-305-9881 or by visiting our website at rcaboysacademy.org. Renaissance Christian Academy, developing young men to be great leaders through Christ-centered learning.
Thank you and welcome back. We thank our show sponsor in particular, SIP for Your Cause, and we thank all of our advertisers for their contributions that make this opportunity possible for you to get this type of great information. So as we continue on with our second segment, we want to move in and let's find out and let's be educated about what are federally qualified health centers.
Federally qualified health centers actually is a network of safety net providers and safety net organizations that come together across the entire nation to provide services to patients that are in need or those that are considered to be either underserved or in underserved communities. Many times that may mean rural areas where there's a limit to the number of providers that there are to the number of people that live in the community.
Yeah.
Sometimes it may be to eliminate the inconvenience of driving miles and miles to get to a healthcare physician or dentist.
Yeah.
So that's what the safety net concept is to provide access to people who ordinarily would not get it. But believe it or not, in urban areas and in cities, that disparity still exists. So that's kind of how we are. We're positioned in an urban area.
Right.
However, we still see a great need for patients to be able to access quality care in a convenient manner and in an affordable capacity.
Okay.
And so that's the whole concept. And as I mentioned, federally qualified health centers is the community health center network that exists throughout our nation. And as a part of that, there is that federal connection to the Health Resources Services Administration, otherwise known as HRSA.
Yeah.
So we do receive some funding from HRSA, and that's how we're able to offer discount services to patients to ensure that
Very good.
people are getting the care that they need. It's so much more important to think of health care from a preventive perspective and even from a wellness perspective. And so to stay on top of the things and to ensure that people are getting immunizations, children are getting their dental exams, they're getting eye screenings, that we're able to manage those conditions that require long-term care, such as diabetes, hypertension. That requires not only access, but I think it works best when there's a relationship there.
Absolutely.
So that people are feeling that they're partnering
Yes.
with their health care, they're feeling comfortable with the setting and the environment. And I mentioned
that nothing's been done to me, but together we're working for me.
We're working together for the same goal. And we are fortunate to have a team that comes together for that common cause as well. And I think that you will see that reflected in the community health center sector of healthcare.
One of the national initiatives that a federally qualified health center is our patient-centered medical home. And we boast of a patient-centered medical home. And Dr. Jada spoke to that earlier. Not only are we doing dentistry and medicine and some of the other services, but we're patient-centered. So when you walk into our clinic, you may be coming for a asthma treatment, but you're going to be looked at as in your entirety, in the entirety. So we're patient-centered, and so that's a national initiative that we like to talk about and tell people about as well.
And I don't mean to belittle this, what you just said, but it just reminds me of our car, you know. And I just recently shared with my wife, we began to take our vehicle to another location other than the dealer. And what I noticed was that whatever I went in for, that's what they did. And when I came out, and I didn't notice at the time, but as I began to go, and I kept saying, oh man, we didn't get the oil change. Or, you know, and when you said that about that you're patient-centered, that they may come in for a specific reason, asthma to be specific, that's not all you're going to check out. You know, you're going to look at the whole person, and if you have to address those other issues, you will. And and again, please forgive me for the analogy with the car, because there's definitely no direct comparison, but the philosophy is the same. Is that I love it when people take care of me holistically rather than just come in and, you know, just nitpick here and there, and then I got to keep going back and back and back. So great. I'm glad you shared that with us. Anything else along those lines, ladies?
Well, I think the other thing that we like to take into consideration is looking at a plan for your health and helping people to see their health as a long-range plan. And, you know, something that happens in dentistry with the dental plan. So we're able to take a survey, and sometimes, you know, that may mean literally a survey to see how's this thing impacting you, or what connection could this have to you, or have you considered these things? And so I think it works well to be able to offer those. And it may not have happened all in one sitting, but we're able to create a plan, and we're able to follow up. And I think that those are things that are important as, healthcare changes again and again. I think what doesn't change is the care.
Yeah, and I'm glad you mentioned that, because that's what I'm hearing. I mean, all while you're talking, I'm just thinking about all the things that legislation, all those things can come about the impact. But I'm hearing, and that's why I go back, and that's why I describe you guys as that old time medical family doctor, family dentist that make those house calls. I mean, that's what I'm hearing. It's that, regardless of what they have to deal with from legal, federal, and all those things, state, you guys are focusing on what matters, and that's the delivery of health care at its finest, and makes sense. So I commend you again. I know I've said that, but I am just super excited about Whitefoord Inc. And I guess you guys could see. You've seen me excited before, but I don't know if I've been this excited on camera. But I am just totally impressed with the holistic, comprehensive approach to healthcare, dentistry, medicine that we're hearing, and again, the other areas that we talked about, even to pediatric care. So again, I'm going to encourage you to go to www.whitefoord.org, and Whitefoord is WHITEFOORD. I want to move on. I know we got to keep that time in mind, but you guys have been wonderful guests, and I want to get as much of this information out of you. Let's talk about emergency and walk-in patients. How does that work?
Well, we have emergency appointments, and we have them daily, and we have specific slots for emergency patients. We see them with open hands. We welcome them. For us, it's a part of our day.
Okay.
Unfortunately, it's a part of our day, but it is a part of our day. So a broken tooth on the weekend, something's been hurting me for a month or greater, that's just a part of our day. So we welcome those people too. If the requirement is to require an extraction or kind of sedate the tooth, we do those as well. Okay. So that's on the dental side as our emergencies. I kind of mentioned a little bit about asthma and some of the acute things, and Dr. Jada can help you with that as far as their emergencies. But those are the typical emergencies. Trauma to the face or anything like that. Yeah. We handle all of those things.
Okay.
Yeah.
That's, and again, I'm continuing to learn more and more, and I want to make sure that we get as much information to you. But again, you can find out all of the information at the website. I want to go and let's look at the school environment to a degree. I know that there are school dental screenings that are required and those type of things. So do you provide the screenings for school? Really?
We do. That's one thing that we do yearly, and we do it very intentionally. We screen the entire school, and we provide screenings for basically Atlanta, and there's a 330 form that many of the students need in order to get admitted in school. We provide the dental screening as well as the medical and the vision and the eye screening as well. So we provide that, and we find that that's really helpful to the parents who need that. So we provide that.
I can imagine. I mean, our son is 20 now, but when we think about, all those requirements for
it's a whole lot.
Do you know? Yeah. And so if we had access at that time, just, okay.
And one stop,
So, so that is wonderful. That's great. Now, let me ask, on the medical side of things, I know our son was involved in various athletic programs and stuff and physicals that were required. Do you provide that as well?
We do. We provide sports physicals, annual physicals, or checkups or health exams. We, as I mentioned before, we do provide immunizations. We do vision screenings as well as part of those. Yeah. We're able to do lab work on site, so we're able to some things we're able to get the results right away in the office. Some things we do send our labs off and we get them back in a very timely manner, and we're able to communicate results to families. And we partner with several of the schools and the coaches. Okay. We are based out of Atlanta public school system. However, we do service students from schools all over the city, the county. So we don't place limitations on that. I think what's important to note is that being school-based means that we're place-based. We're housed within the school.
Right.
And that benefit is there because we're caring for children in the context of where they spend most of their waking hours.
Yes.
So that's the reason for being so expansive and open, and therefore injuries or illness that's unexpected. So we do offer same-day and walk-in visits. So, but by the same token, we do take other members of the community. We have students now that have gone on to college that still come back and identify us as their primary care home.
With their children.
Yes.
And some with their children. So that's what happens when you get 20.
Well, let me tell you, the business side, that business model, I'm like, you guys are smart because you're creating lifetime, even though, when you think of medical and dental, you generally think of lifetime, but the way you guys are situated, that is unique, that you actually get them when pre-K,
They sure do.
That is awesome. Well, let me tell you, I know we are coming to a close, but I just wanted to go back. We talked about your team of health professionals and that are on staff. Would you just share that again, in any detail that you would like, just so that they would know
Sure.
again?
I think that's a very important point to reiterate, is that our team, we have a team of qualified professionals. We have board-certified physicians, board-certified and highly trained nurse practitioners or mid-level providers.
Yeah.
We have medical assistants, several of which are certified as medical assistants. I'll let Dr. Patten talk a little bit about her dental team.
Okay.
But we have highly trained, highly qualified professionals that keep up with updates and current changes in healthcare. So we're able to do continuing medical education. And we attend in leadership a number of conferences as part of our FQHC connection.
Yeah.
We're often going to statewide events that allow us to exchange ideas and information about how we can continue to improve healthcare delivery. And Dr. Patten can tell you about her dental program and how we connect with training as a training site.
Yeah, we've had the great opportunity to be able to assist Georgia Regents University in training their students, as well as some of the other institutions around. And so with that in mind, it kind of puts the word out for everybody.
Yeah.
And not only does it put the word out, it also ingrains within your students that this is another way of providing health care. And the buy-in is phenomenal, and we are happy to be a part of that buy-in.
Yes.
But we have a hygienist on staff that's there, and what we do with her is she runs her own hygiene programs, and we try to do a lot with prevention. So we we love to see everybody, but we're trying to start young. We're trying to do a lot of prevention. So that's our primary goal in the school, is to do some preventive things.
Very good. I tell you, you have heard an extensive conversation about the services and the delivery model that the Whitefoord Inc. brings to the community. And when I say community, I'm no longer, as before the program, speaking to just the East Atlanta community, but I'm telling you the state of Georgia. Again, we encourage you to visit them at their website, and I'm going to allow them to share with you again how you can reach them. And I am strongly encouraging you to reach out to them. Tell them again how they can reach you.
Sure.
www.whitefoord.org. Like us on Facebook.
Love it. I love it. I love it. Guys, we thank you for being with us today for another episode of Let's Talk Nonprofits. Ladies, we are so pleased to have had you as guests today. You have been more than refreshing. You have been refreshing from the standpoint of genuine care for people and community. And I'm looking forward to personally, as well as our business, making sure that people know about Whitefoord Inc. and be able to come and receive services from you. So thank you for joining in with us. Again, you can get all of our episodes at www.bizlinks.tv. Also, be a subscriber at our YouTube channel. /BizLinks TV. Like us on Facebook, BizLinks TV. And you've heard also that they've shared with you how to reach them on the social media links as well. So thank you again for your time. Thank you for your opportunity to remember. Forward this episode so that others can learn about the opportunities that are great and massive, extensive at Whitefoord Inc. Thank you. Until next time, this sip's for you.